So today our topic is lymph node. So first I want to give you a general idea about lymph nodes. So this is your afferent lymphatics. Okay, so they bring lymph from the body into the lymph nodes. This is your lymph node. This is the hilum, which is an indentation from where the efferent lymphatic exits and the blood vessels enter and leave. Next, you have this dense irregular connective tissue capsule that covers the lymph node. Now, if you take a cross section of a lymph node, this is what it looks like. Now, this is the capsule, right? That was covering it. And the inside of the lymph node can be divided into three regions. The outermost is going to be your cortex. The inner one will be your paracortex, and the innermost layer will be your medulla. Now, the cortex consists primarily of B cells, and you can see these aggregations. These are known as follicles. The follicles can be divided into primary or secondary. Primary will be your follicles that contain inactive B cells, while the secondary follicles consist of germinal centers that have your active B cells that are undergoing proliferation and various immune responses such as somatic hypermutation, class switching, and affinity maturation. And basically they undergo this increased B cell activation and proliferation in the center, and that is why it appears pale on histology. Next, you have your paracortex, which contains your T cells. Then you have your medulla, which contains your plasma cells and your macrophages. Now, let's look through your gross structure. Those are going to be your afferent lymphatics that drain lymph into the lymph node, and it is surrounded by a dense irregular connective tissue capsule. It is divided into three regions: your cortex, paracortex, and your medulla. The hilum is the indentation from where the efferent lymphatics exit and the blood vessels enter and leave the lymph node. Your efferent lymphatic drains the lymph out of the lymph node and into the circulation. Your cortex, like I said, contains your follicles, and these follicles consist of B cells. The lymphoid follicles, they are divided into primary and secondary follicles. The primary follicles contain your inactive B cells, and since they are inactive, they appear dense and dark on histology. While your secondary follicles contain your germinal centers, which consist of active B cells that are undergoing various immune responses, and because of that, it appears pale on histology. Your secondary follicles are surrounded by a mantle zone, which contain your resting B cells. All in all, the important point that I want you to take away from this slide is that whenever you hear cortex, I want you to think about the B cells. Now for your paracortex, it is the area between your cortex and medulla. It is the T cell region. Over here, naive T cells get activated by antigen presenting cells. It contains high endothelial venules, which are responsible for bringing the lymphocytes from the blood into the lymph node. The important point that I want you to know is that paracortex is diminished / underdeveloped in Dijort syndrome. The reason being because in Dijort syndrome, you have a T cell deficiency. So you have low T cells, right? And because you have low T cells, it makes sense that your area which is rich in T cell will be diminished or underdeveloped. And in cases of viral infections where T cell response is very high, you will have paracortex hyperplasia. Now, there is an anatomical advantage of cortex and paracortex being close together, and let me tell you how. First, you have your afferent lymphatics, and they are bringing an antigen, and that antigen can be from a pathogen that is infecting your body. Now, that antigen travels, and the first region that it encounters is going to be which one? The cortex. The cortex consists of which cells? The B cells. Now, these B cells will take that antigen and they will present it on their MHC class 2. And now, since when this antigen is presented to the T cell, that is going to be a CD4 positive helper T cell, the T cell receptor, along with its co-receptor, which is going to be your CD4, will recognize this antigen. Then simultaneously, you have this CD4 ligand, which is this, over here on the T cell, and this is your CD40 receptor on the antigen presenting cell or your B cell. Now, this interaction, both of these interactions are very important and vital for your immune response. When this interaction occurs, what happens is that your CD4 positive helper T cell secretes cytokines. These cytokines are important for the activation and proliferation of your B cell. It can turn it into a plasma cell, it can undergo class switching, and many other functions which are important for our immune response. And the reason why it happens is because your cortex, which contains your B cells, and the paracortex, which contains your T cells, are close together. Okay, now the medulla. The medulla contains your cords and sinuses. The cords are where you have your plasma cells, and the sinuses are where you have your macrophages. So in immunodeficiencies such as SCID and Bruton's, right, there can be decreased plasma cells that leads to decreased antibody production. So in these diseases, when you look at the serum Ig levels or immunoglobulin levels, they are all low. Now, finally, these are the most important points that I want you to take away from this video. The cortex is your region of B cells. So if you have any deficiency or problem of B cells, then your cortex will be the one that will be effective. The paracortex is your T cell region. So if you have any problem with the T cells, the paracortex will be the one that is affected. Next, the medulla contains your plasma cells and macrophages. So if you have a combined B and T cell deficiency, then it obviously makes sense that all of these regions will be affected simultaneously. And that is the case that we see in SCID, severe combined immunodeficiency syndrome. And since it has B and T cell deficiency, so you will see diminished or scanty lymph nodes in SCID. In Digeorge syndrome, since there's a T cell deficiency, you will have a diminished paracortex. In Bruton's, since you have a B cell deficiency, right, you can remember B in the Bruton stands for the B cells. So in Bruton's, you have B cell deficiency that leads to absent lymphoid follicles in the cortex because you have no B cells to start with. Finally, that defective CD40-CD40L interaction is seen in hyper IgM syndrome because you don't have that second interaction that leads to no release of cytokines and no activation or class switching of the B cells. That's the reason why you have increased amounts of IgM but decreased amounts of other immunoglobulins.